Dear friends, greetings from SAANS Foundation. I am Dr. Bose. I welcome all of you in the coming Sunday, the 6th, and on a very interesting webinar, A Journey from Illness to Wellness, relevant to our project SAANS, a systematic approach and analysis to neurophysiological wellness. Dear friends, what means to be well and to achieve well-being is fundamental to human conditions. Wellness is a very complex trait, and people right from the Greek period have been trying to explain the meaning of wellness and life well lived. Scholars and experts and try to map wellness in different concepts and methodology, but still the concept of wellness is very subjective, and most of the things are still unknown. Thanks to the imaging techniques, ever since we have evolved functional imaging techniques, the science tried to correlate a sense of well-being with your neurophysiological mapping techniques. Our neurophysiological mapping techniques has really opened up the eyes. Now with our scientific tools, we can understand and map wellness. And it has been found in a very simple language, the front portion of the brain, the frontal lobe, decides your mental health. What I mean by mental health is feeling positive, create a kind of a harmony, seeing the bigger picture, your communication, your attitude, and everything. But mental health is not enough. If you really want to have a sense of well-being, it has to be a happy wheel. It has to be a 360-degree approach. What we have tried to project through our questionnaire, that a life well lived or understanding a sense of wellness needs a 360-degree approach, what we call a holistic wheel or a kind of holistic harmony. So one has to move from mental health, emotional health, environmental health, intellectual health, career health, social health, spiritual health, and cosmic health. All these healths are very relevant and very different, though they are very interconnected. So along the mental health, which determined by the front portion of the brain, is not enough. And let me tell you, the emotional health, which is a very integral part of your well-being, is totally controlled by a different portion of the brain, what you call the inferior portion of the brain, what you call limbic system. So it may so happen you may have a very amazing mental health. You may be very positive, upbeat, but you may have a very poor emotional health. So emotional health has a different kind of symptoms. Mental health has a different kind of symptoms. If you're not enjoying the environment, it has a different kind of symptoms. If you're not enjoying your intellectual or caring, it has a different kind of presentations. And similarly, the social, the spiritual, and cosmic, the influence of the nature has a different impact, and all are very important and they work as a trigger. So what in SAANS project, what we're trying to do is that this is the first time we are trying to integrate the subjective understanding and the science behind in the form of a questionnaire, understanding the human mind with a structured, well-driven, objectively assessed questionnaire comprising of your physical health, mental health, emotional health, and all the components which I've discussed. Now, when we talk of physical health, it's not only how physically fit you are, but physical health, a very important part of the physical health, what we call the physical health wellness, is your nutrition and your autonomic balance. Now, what is an autonomic balance? Now, how much of balancing you have got, how much of every human being has the extremes. You may have very sympathetic behavior, like what Our human being is very, dynamic, or what you call very diurnal. You may have the elements of excitement and positivity, what you call the anger, the excitement and restlessness, coupled with the opposites called parasympathetic, very low, down, not feeling good. So this combination of sympathetic and parasympathetic, the balancing decides your holistic harmony, what you call autonomic balancing. So what we have tried to do it through our SAANS wellness questions is a very thought-provoking, cohort-based, based over 20 years of our experience in the science of medicine. We have tried to understand the human mind basically touching on these different components of this human being, from physicality to the mental, emotional, environmental, spiritual, social aspect, spiritual component and the cosmic part, the influence of the nature on you, the influence of environment on you, how much you're socially connected. Socially connected is not then how much you're connected with the outside world, what kind of connect you're with yourself. So what we have tried to understand, after we score the people medically and through these neurocognitive questionnaires, we want to scale people depending upon the score. Now, for example, if we find the mental health is poor and other components are good, then these are the people, they need a different kind of skilling techniques, what we call philosophical skilling techniques. And I'm very grateful to the Department of Philosophy, Ramjes College and Delhi University. They have taken a lead step to help mankind, students, teachers, and all the cohorts to understand that every component of wellness has a different kind of skilling techniques. Now, for example, when I talk of mental health, if the questionnaire says that mental health is poor, then these are the people, they require a different kind of philosophical technique, what you call cognitive behavioral therapy. So thought decides your behavior, behavior decides your actions. So our august faculty of experts, of professors, and whole team of philosophers, they are going to talk about and tell people the important philosophical techniques. Now, when you talk about emotional health, if you find the emotional score is poor, then probably they need a rational emotive behavioral therapy. It's entirely different. So they help you to make you much more rational. Similarly, the different components of wellness have the different kinds of philosophical counseling techniques. So when it comes to, say, social, then you need logical behavioral therapy. So these are different philosophical techniques, very interesting. I'm dear students who have been working very hard, and thanks to you, you have done an amazing job. So you will find that every individual have his own core, own sense of wellness and own areas of comfort, and they can always learn from these techniques. Then which are the areas they need to improve, and which are the areas they are happy with it. So I think this combination of doctors working on patients and philosopher counseling, it's a magic sauce, I call it. So this is a very integrated way where our doctors, therapists, philosophers, students all put together trying to bring a concept called a wellness score. Now, you may have an amazing body with all the parameters being normal. That doesn't mean that you're not vulnerable. Maybe your copings are poor. You may go into depressions. You probably, and COVID has started a lesson. I've seen the people with the fittest bodies and people with, even they have recovered from COVID, but they are not able to cope up. They are sleepless. They are not getting good sleep. They are getting aches and pains. They are into major depressions. They are into substance abuse. And this is what is all about long COVID. The biggest research which is going on in the world is on long COVID. That means after months of their recovery, they are having problems. So mental health and its consequences are huge. It's very intricate and very complex area. The scholars, the researchers, this is the first time the professionals, medical professionals, and philosophers and therapists are working together to understand the meaning of wellness, to score human being. And based on the score, the questionnaire, if you go through, my dear students and the people who have gone through the Google questionnaire, it's very elaborate and very interesting, so that we can easily map people which scale you are in from 0 to 10. And wherever there has been confusing, we are using emojis and all those what you call visual analog scale. So, dear students and the cohorts, Please join us on this interesting webinar where me as a doctor, the founder of SAANS Foundation, will talk about the mental health and its consequences in COVID. Professor Bala will talk about the philosophical counseling techniques and how we can achieve the holistic harmony. I will be basically talking about a very interesting area that I've been getting about 50 to 60% of the patients in my clinical practice that people are not feeling good. They are very sympathetic. That means you're feeling restless, listless. They are ventilating fast. They are always feeling breathless. These are called hyperventilation syndrome. Now, hyperventilation syndrome is a very interesting thing that when you're mentally, you're not very comfortable. When your coping is poor, when you're overstressed, when you're feeling very negative about, your respiratory system starts behaving, erratically. You start breathing faster. When you start breathing faster, then you have all the symptoms. What happens? Normally, through a normal holistic breath, about 10 to 12 per minute, so we bring adequate oxygen into the human body and similar amount of carbon dioxide goes out. This is called balanced breathing. But when you're hyperventilating, when you're stressed out, when you're breathing fast as you are running, so what happens? When you breathe fast, you wash out more carbon dioxide. So body goes into a complex chemical situations, what you call alkalosis. And that gives you all kinds of symptoms, aches and pains, listlessness, lack of sleep, exhaustion, fatigue. They always feel breathless, and if they persist, they can be very dangerous. They can go into major depressions and all. These are truly not pathological. They need philosophical counseling. So, dear friends, as a pulmonologist, as a professional, I will be giving a case presentations. How bad could be this hyperventilation for all the age groups, especially the students, those who are confined to a space. They're not very sure what is happening. Now the war is on. So mental health and its consequences are image, and that can really affect your respiratory system. And through this respiratory system, there is a total disarray of your chemical system, and you can go back to worse. So breathing techniques is one of the areas we work at SAANS Foundation, which is really helping people. So dear friends, this will be a very interesting amalgamation between the philosophers and the pulmonologists put together as a joint effort to give a meaning of wellness in a journey from illness to wellness. So illness is a state of mind where when you're cluttered, not feeling good. So by those techniques and mapping with a useful tailor-made philosophical techniques, we can help you to achieve wellness. So please join us. It's a very interesting webinar, and a lot of effort has been put in. Thanks to our team, Professor Bala, Dr. Maushmi, Dr. Amit, my team from SAANS Foundation, Dr. Pratibha, Dr. Siddhant, and everybody anybody and everybody who's related, and all the guest speakers, whosoever is involved with us. Let's make it big, let's make it practical, let's make it very concise, and let's try to reach out to more and more people so that we can help those people at large and at the same time understand the concept of wellness. Thanks a ton. Regards, Dr. Bose, and have a great day.